Hello everybody, I am Dr. Santosh Kumar. I am an orthopedic and joint replacement surgeon practicing right here in Kolkata, and I head the Purva International Orthopedic Foundation, a foundation which is determined to bring the world's best in orthopedic surgery right to your doorsteps in Kolkata at an affordable price. What we are going to talk today is about the problems pertaining to hip arthritis and hip replacement. Now, hip arthritis is a major issue because its hip joint is the biggest joint in our body, and hip arthritis can paralyze movement of a person and significantly deteriorate the quality of life. Hip arthritis causes severe pain in groin, sometimes radiating to thighs and knees. Now, once hip arthritis is advanced, that is it's advanced hip arthritis, which can be either osteoarthritis, rheumatoid arthritis, avascular necrosis, or tubercular arthritis of hip. We need to replace the hip joints. Now, our hip joint is a ball and socket joint. This is a model of our hip joint. This is the pelvic bone. This is the femur bone or thigh bone. It joins together to form the hip joint, which is covered by very tight capsules, and it's a ball and a socket joint. Now, in hip replacement, we replace this joint by something called a hip replacement implant. This is the implant of hip replacement. This is the femoral component which goes inside the femur bone or thigh bone. This can be cemented or uncemented. In young people, we generally prefer uncemented implants, and in older people, we prefer cemented implants. And this is the head. This head can be metal head or it can be a ceramic head. Shown here is a ceramic head. This pink colored head is a ceramic head, and this is the socket. This is the ball and this is the socket. The socket is put inside the pelvic bone, that is known as acetabulum, and this socket is again lined by it can either be lined by polyethylene or it can be ceramic. Shown here is the polyethylene liner, and this is a ball in socket type of joint. This is a total hip replacement. This acetabular component is also uncemented. It is fixed to the pelvis bone in an uncemented way. Now, this gives painless movement. Person after hip replacement surgery can start moving from the very next day of surgery and climb stairs by 2 to 3 days, and a person can start by swimming and riding bicycle and can join his or her office work by 1 to 1.5 months. Now, the recent advances that we have brought in hip replacement to here include the computer assisted surgery by Orthopilot navigation system, and we have started doing very high head, that is dual mobility hip cups, that increase head size in the implant, allows a person to sit on ground and even squat if needed.